As we continue, Dr. Brian TYSON and Dr. George FAREED are with us. Let me ask you a question, because everybody says to me that I ought to be telling people what to do. Now, I am trying to tell people to hear from a variety of views. You can read about the clinical studies on your own, and I urge people to do that. Everybody has a doctor. Many people have doctors in their lives, plural. Others, know people in the medical profession, and I'm urging people to make that consultation based on your background and your specific health condition. Are there any people that want to be vaccinated that have health issues, Dr. FAREED, that you would advise them against getting vaccinated?
I would say that there are not many in that who fall into that category, Sean. I think patients that are in this swath of over 50 years of age and have comorbidities, that it's worthwhile to take the chance with the vaccine. It's proven to be fairly safe for that category of people, and that's where it would be most helpful. The other aspect,
and those are the
vaccines,
people that the one thing that did bear out the entire time was those people older, pre-existing conditions, comorbidities, compromised immune systems. That stayed constant.
And those are the ones that do deteriorate with COVID-19 and end up on ventilators, and that's what we don't want to have happen again in our country. What I'm seeing also, I think Brian agrees with this, that patients that recover from COVID-19 have durable, long-lasting immunity, and they shouldn't be forced to get vaccines. That they're more likely to have these side effects that Brian talked about, and that spike protein that's produced by all these vaccines is a pathogenic molecule. And it can spread. If it does, it may provoke severe lung symptoms. And in addition to the other problems that Brian talked about. So it's that's why I'm particularly worried about giving it widely to children and to young people who don't have any chance of deteriorating with COVID-19, and that can be treated with our early treatment. I'll come back.
Do you worry about the variants and the mutations that are coming along? There was one report out of Europe that people in their 30s now were struggling where they hadn't before with one of the mutations, with one of the variants.
Well, I think those are more highly infectious. Brian, go ahead and pitch in on this if you'd like.
Yeah, let me speak on that. And the reason why I'm saying that is because at our clinic, we've seen over 7 of the variants already. We've also seen the Brazilian variant. We've seen the UK variant that everybody's been talking about.
What about the South African variant? I heard that was very virulent.
The South African I have not. Okay. But we've been seeing variants in coronavirus since back to July. And I can tell you that they still respond to treatment. Every one of them has still responded to treatment. Going back to we're over 5,000 patients. We've only had 10 hospitalizations, and we've had 3 people pass away with partial treatment. Everyone else who's had early treatment, we have 100% success in treatment, despite all of these variants that you're hearing about. Yes, the younger people are getting infected, but when you get them started on treatment early, they all seem to do well.
Yeah, and Sean, these variants don't develop resistance to this combination of agents. It's sort of like HIV treatment. We use a combination of agents to effectively suppress HIV multiplication in HIV patients. In the COVID-19 variant situation, they're all still very susceptible to the combination, and that's why we use a combination of safe agents.
I will come back on the other side. Final thoughts, Dr. TYSON, Dr. George FAREED, 800-941-SEAN, then your calls, final half hour.